Hey, it's Jessica DeMassa with WTF Health. What's the future of health? I'm talking to the who's who of health tech and healthcare innovation. And hey, guess what? They're still out there raising money and here to talk about a $30 million strategic round that's just been raised by Memora Health is its CEO, Manav. Manav, it's great to have you here.
Yeah, thanks so much for having me on and really excited to chat.
All right, before we get into this funding round, which is very exciting in and of itself, particularly right now in this climate that we're in, I want to talk a little bit about what Memora Health does because doing my research, I'm reading through your website, I'm reading about the fact that you guys have these really conversational text messages with patients. You guys work with primarily health systems right now. And what you do is you help kind of guide them through a patient journey, whether it's like a maternity care program or surgery, cancer care, chronic conditions, with this conversational text. And yet, you don't consider yourself a patient engagement company. Instead, you guys are talking about yourselves in this category called intelligent care enablement. So I want to kick things off by having you start out by explaining this whole concept of intelligent care enablement and specifically what the nuance is here that we need to be aware of and how it's different from this whole patient engagement category.
Yeah, 100%. So appreciate the question. And there is quite a bit of nuance there. And the best way to understand it is to almost just get Memora's story in its entirety of why did we choose to build our particular platform this way. So the core kind of underlying thesis behind which Memora was started was this trend that we were seeing in the healthcare industry over the last 15 years of how more and more practices around care delivery are starting to move outside the walls of the hospital, right? And care is generally just becoming a lot more unbundled. And there's tons of reasons why that's happening. The Affordable Care Act was a very big catalyst for that. There's all sorts of new entrants in healthcare. The concept of consumerism has become more prevalent in the industry, right? All sorts of reasons. And with that transition, the one thing that's been kind of abundantly clear is that the actual infrastructure and core technology that you use to manage a patient outside the walls of the hospital is dramatically different from what tools providers use right now and how they manage those patients when they're directly in front of them. So
Okay.
at its core, most healthcare organizations that deliver care just needed brand new infrastructure to manage those patients after they leave, right? And that's the thesis on which Memora was founded. And over the course of the last, 10, 12 years, there's all of these new companies that have shown up, right? There's messaging companies and monitoring companies and patient engagement companies and scheduling companies and everything in between. And we've seen kind of a very, very big distinction between there's lots of tools that focus just on the provider facing pieces, right? And making parts of the work for providers or for the entire healthcare organization easier. And then there's all sorts of tools that are purely patient facing, right? Whether they're messaging tools or monitoring tools or whatever they may be. And if you really reflect on how healthcare delivery looks right now, it still looks and feels the exact same as it did 15 years ago, right? So what is really the gap between all these new tools are showing up, but the actual experience for the patient and the provider is still very identical and similar. And there's no good infrastructure that's just stitching the entire journey or process together in a way that very, very well balances both the patient experience and the provider experience. So that's the crux of what Memora does. We will go into a healthcare organization and we look to understand not just what messages a patient should get, not just what a provider does, step by step in the context of a care plan. What is the entire workflow that that particular care team should be following? That includes what information a patient should be getting, what reminders they should receive, what symptoms they should be screened for, what physiologic data is important to collect, when they should come back for their visit, and everything in between, right? And Memora takes all of those insights from that site. We go ahead and digitize that into these care programs that our team maintains as our core product. And those care programs have two components to them. The first component are these entire kind of text-based journeys, which is the patient engagement piece, right? So yes, a part of what Memora does is patient engagement, even though that is not the crux of the platform. And we'll send out specific to their care plan, these almost personalized journeys that are an extension of their care team that will send them educational information, symptom screens, medication reminders, all sorts of clinical guidance, right? And then second, which is a very, very critical distinction between Memora and a lot of patient engagement tools, is all of these clinical algorithms that automate parts of the workflow for the care team specifically. So automatically checking the record to see, hey, we discharged this patient 2 days ago, and it's clear that they have a new medication listed in the medical record. Let's go ahead and check in to see if they picked it up and then document that back in the record automatically, stuff like that, right? So a lot of the core focus of what Memora really solves for is how do you take kind of the 50% of work that is in the middle of a care team's workflow, or what that a clinician does every day, that's not administrative, and it's not actually top of license or clinical decision making, but it's clinical and it's almost oriented around coordination and navigation for the patient. That is very, very routine or very systematized. And how do you automate a lot of that and give them a lot of that time back, right? In a way that they're spending their time on things that are actually top of license.
Okay. Now this makes, I want to talk a little bit more about this side of this, because I think that this, like you said, this is kind of like the secret sauce that sets you apart from a regular patient engagement company. Because my understanding is that there's a lot of, clinical guidelines that are baked into this provider facing side of things. And, when you say, take away some of the routine, care management type stuff that they spend a lot of time doing that maybe contributes to a lot of burnout. You mentioned, putting things into the record or tracking the record or making sure that the patient record knows. One of the stats I saw on your site that was really impressive to me was a number from one of your health system clients with their postpartum care program. I mean, the number was kind of interesting to me in the sense that it talked about 30,000 messages being exchanged between patient and provider in that specific postpartum care program, but that only 150 ever really needed to be elevated to the point where a clinician needed to intervene. So let's dig a little bit deeper into how this magic happens here. Okay, so explain to me how that works. Like, how does your tech know how to triage? Like, where is the basis for that decision making coming from?
Yeah, sure. That's also a great statistic that I think.
I love it. That's incredible. I'm like, oh my goodness, like the burnout we're avoiding here.
Yeah, exactly. And it's kind of like if you ask any health system, they want to get to a place of like, in 100 days, can you have 100 touch points with a particular patient to make sure that they have a very, very high touch experience in how they manage their care? Can you make sure that you do that in a way that does not totally sacrifice the provider's experience and the provider's ability to manage that patient, right? And Memora's ability to balance that, I think, has helped us get a lot of traction. So process-wise, the way that we actually design these programs is we'll go into that healthcare system and take all of those insights that I mentioned earlier and use it to create those care programs that have the clinical algorithms that focus on a lot of the guidelines and kind of tasks that we should be automated inside a workflow, plus what messages a patient should be getting at any point in time. We have an entire clinical team in-house at Memora that actually manages all of those different programs. So there's a couple of important pieces there. One is our programs don't make any clinical decisions, right? Memora is not a tool that is intended to help a patient say, hey, if you're feeling nauseous, you should take this medication, things like that, right? It's very much a tool to automate everything and kind of streamline all the data collection up to the point where a clinician can make that decision as quickly as possible, right? The second thing is that our team actually designs all of those different protocols in a pretty centralized way. So let's take like a postpartum care example, right? Which is what that stat that you or reference is based off of. In that particular example, right, the way that Memora's postpartum program is designed is we'll take things like a booklet that a site is giving a patient, any sort of clinical protocols or pathways that they're following, any sort of symptom management guidelines. We go ahead and write out what does the entire journey look like? What is a workflow for the care team? What escalations happen? What particular kind of instruments are we sending this patient? When do we do a postpartum depression screening? Things like that, right? Once we go ahead and write that out, we share that back with the care team and they can say, hey, I actually want to slightly adjust this. I want to use a different instrument, or I want to go ahead and send this message on day 7 instead of day 14, things like that, right? And normally like 20% of it ends up being configured by the site specifically, right? Okay. But we'll go ahead and implement that at that particular site. When we go to another site and they say, hey, we're interested in launching a postpartum care program, we'll show them the program that we've designed and they can opt to use that, or they can say, hey, we actually have a bunch of protocols that we've designed in-house that we want to implement instead and we want to digitize. And we'll take in all of those different protocols go ahead and digitize those, right? And then actually go ahead and implement it. And over time, in certain clinical areas, as we build depth, we start benchmarking, hey, why did this program that we designed with site X perform better than this other program with site Y, right? What are the demographics of the patients at site X versus site Y? What do they do differently? And eventually kind of get to a place of, can you actually optimize what clinical program Memora is actually putting out into the market and what we lead with when we go to a net new site, to just understand, hey, when a patient says that they're feeling nauseous, the guideline is there's 3 core pieces of information that you need to figure out, versus another site may say, hey, I want 5 pieces of information on this particular patient, right? And we'll refine it over time as we collect more and more data on how the programs get used.
Okay, so that's interesting. So you're able to actually like learn from different sites based on the structure that you've built in by digitizing the workflow and then being able to compare and collect the analytics around them. Yes?
Exactly. That's exactly
Okay,
it.
got it. All right. So I want to ask then on the patient side of this, because this is where, I think that all sounds really awesome in terms of delivering really high quality care, which I know the provider side is going to be very excited about. And also, in terms of like a cost savings, like from a cost savings standpoint, just being able to like optimize their workforce and give them back some of the hours in the day by, having this really solid data driven look at what's best practices within a particular care journey. But on the patient side, I mean, I feel like there's so much happening, and you mentioned it too, at the beginning here about all of these different companies that are, have their fingers in the patient engagement pie here. And how do you find, when you're thinking about what you're doing with Memora, how are you guys making sure that you're not further fragmenting the patient experience? Because, as great as that sounds to get all of these text messages coming in this one specific thing, this postpartum program, maybe, if I'm also getting different text messages from a different startup that is working with my primary care provider, or, from my, whatever else it is, how do you avoid being just another piece of noise within that patient journey with the health systems that you're working with?
Great question. And it's something that, I probably spend like a disproportionate amount of my time thinking about. So I think that there's a couple of like design decisions that we've chosen to make that are very conducive to that, to make sure that Memora is not just, hey, here's another company that is sending you texts and you get texts from like 9 different phone numbers, right? Or there's 9 different interfaces that you're using if you're a provider. The first biggest decision was Memora by intention chose to be a text-based platform, in the sense that, one, you want to make it as intuitive as possible for patients to use, where they're not learning a net new interface, they're not downloading an app, they're not logging into a portal, right? Almost eliminating as much friction as possible for a particular patient. That way, at least the experience of how they navigate a system like Memora is very intuitive, right? That's one important design decision. The second design decision was Memora builds pretty deep integrations with electronic medical record systems, right, and other systems of record. And the goal at the end of the day is to try to optimize how the provider is actually spending time and what data they are looking at inside of that interface. So best way to bring that to life is I'll just give you an example of a particular patient that may be enrolled into the platform. Okay. So take like somebody who's, let's say, diagnosed with heart failure, right? This patient comes in to the emergency room and they're not feeling well. They end up getting admitted and they're diagnosed. And at that point of diagnosis, in the status quo, what happens is that patient gets like a 30 or 40-page booklet of information about understanding their heart failure, right? And it's complicated, and they're going through all sorts of changes. They've just been diagnosed. There's new medications they're being asked to take. There's all these additional visits that they need to schedule. And it's hard. Like 80% of the information is in one ear, out the other ear, right? And they go home. 15% of people actually read that booklet. A lot of people lose it. A lot of people throw it away. And if you're a patient and you have some sort of question, which there's tons of different things that you are now learning very, very rapidly in the first couple of weeks of that diagnosis, you're either going to Google to get it answered, you are calling a general 1-800 phone number for the health system and being bounced around call centers, and it takes forever to get an answer. You are logging into your portal and sending a message into the inbox, and it takes like 30, 40 hours to get a response. Or you're really concerned about your health and you're going to an urgent care or an emergency room, right? Where in most cases you probably did not need to, right? And on the other side, for the care team, you come in every day, you log in to your EMR, and you do your chart review to figure out, hey, what patients am I rounding on today? What patients did I discharge 2 days ago that I should probably call to make sure they picked up their medications? And you write it down on a sticky note and save it for the end of the day. And then at the end of the day, you make all the phone calls and do all the documentation and log into your inbox. And there's hundreds of messages that you need to go through and kind of like picking and choosing, like, hey, I just don't have time to do this. I'm going to figure out and try to read through all of these and pick like the 4 or 5 messages that I have time to actually handle, right? And it's just challenging, right? Like they don't want to look at another interface, and the patient doesn't want to have like a 5th option that they need to go to. So post implementation, what that looks like is, and post Memora, the patient is diagnosed, and as soon as that is documented in the medical record, the provider's not doing anything. They go ahead and document that diagnosis, and Memora pulls out name, phone number, date of birth, diagnosis, medication list, things like that, right? And we enroll that patient into a heart failure specific care program that Memora has gone live with at that site. And that patient, as soon as they leave, they get a text that says, hey, I'm here working with your care team, and I'm here to help you navigate the next several weeks of managing your heart failure diagnosis, right? So at that point in time, some health systems already have texting infrastructure they're putting in place. They have tools that they use to send appointment reminders, right? Or tools that they use to send bill pay reminders, whatever it may be, right? Memora will, in some cases, even integrate with those systems so that they only get text from one phone number, right? In other cases, if they're not doing any sort of texting right now, Memora will own that phone number, and then we can work with almost like build an ecosystem of other partners where we say, hey, if you have other companies that are also sending out messages and you want us to collaborate with them so that they're not getting messages from multiple phone numbers, we can do that, right? So
That's
we kind
cool.
of fit into, it's all about continuity, right? For the patient, should feel as if I have one health system and I have one channel that I'm going to, and it's as simple as possible. And they'll always have things like the patient portal and stuff as well. But one channel where I can very proactively get all of this information, plus actually interact with and very easily communicate with the care team in real time, right? So they'll go ahead and get all of those text messages over time. They'll get educational information and symptom screens and medication reminders, a couple messages a day for the first couple of weeks. And then after that, it'll taper off. And as they go through that program, we're automatically taking all the data that they send back in and writing it back into the medical record in a couple of different ways. It either gets written back as a note if it doesn't require escalation, or kind of as a media file where we go ahead and just kind of store it for that provider so it's part of the medical record. We can, in some cases, make an escalation where we're just writing back into the provider's current inbox, right? And even if we're adding a message to the inbox, it comes at the expense of almost eliminating, or the benefit of eliminating 4 other messages that may have needed to exist, right? So net, the total volume in the inbox goes down. Or in some cases, we'll go ahead and actually write something into a specific data field inside the medical record. Like in Epic, we'll write back blood pressure data to like a flow sheet row is one example, right? And that way for the provider, the way that they use the medical record is the same. They're not looking at another inbox. They go to their inbox and they see a message came in. That message now has all of the clinical context for, hey, this patient said they're nauseous. We asked them how long they were feeling it, scale of 0 to 10, how bad it was, what interventions they tried to do themselves, what was the grading for it. And they said that they want to connect with a care team member, right? So it's easy for you to say, okay, and they have no other symptoms, right? So it's easy for you to see all of that and now get to a clinical decision very quickly. And then they can click into it and they can see an interface with all of the data that Memora provides. And there's an entire kind of embedded view, but their workflow of how they see that notification is the exact same, right?
That is so cool. And I mean, I know for, even on this funding, this 30 million that you just closed, you had big health systems back you in this round. I think Northwell Health was in there and North Shore, Edward Elmhurst Health. I mean, they're behind you. And I understand that they're kind of partnered up with you to help co-develop these solutions. I'm wondering if you could say a little bit more about that. that connection that you have with the health systems as you've been working to build out your own tech and your own products. Because I think like this is kind of the crux of it. I mean, we keep hearing about how health systems, some of them are struggling in terms of generating revenue. They're struggling with staffing shortages. I mean, and some of the stats I read on your site are really impressive in terms of the amount of time this saves. I think I saw 2.5 hours of time saved per full-time employee per day. That's crazy. I mean, this is taking a lot of the tedium out of their workday. And then, I mean, we had talked about burnout already, but say a little bit more about how you think Memora is further differentiated by the relationships that you have with these health systems and the fact that they're, financially behind you as well.
100%. So the very, very big kind of, I guess, inflection point that Memora is at right now is we have a bunch of different partners that we've had a chance to implement these clinical programs with, and we're starting to see really good data on those programs. And we're starting to see scale in how we implement them and how we design them and what data we collect on these programs. And the one thing and the biggest lever for us at this point is, as valuable as these programs are, if we can't find ways to scale them inside of these healthcare organizations, they're going to fall flat, right? Like we don't want to be that company that is, hey, we work with you in this one service line at this one site inside your health system. And yeah, we have great data on 2% of your entire health system.
Yeah, the postpartum program is killing it, but okay.
Exactly. But how is that impacting like these $500 million that I have to find to get to a budget neutral place by the end of this year, right? Yeah. So the big thing for us is twofold. One is we want to make sure that we are being a true enterprise partner with these systems. It's one of the really big reasons why Memora has as much clinical breadth as it does. There's 26 core clinical areas that we've designed programs in, and you can see the full list of those on our website. There's all sorts of muscle that we've built around actually doing an enterprise-wide implementation where we're going live with multiple sites at once and things like that, to make sure that this does not just become siloed into one small part of the system, right? That is at every single system a little unique, right? And it's really, really hard to build that muscle in a way that is scalable and replicable, right? So what we've said is, look, like we're not experts in this, right? Nobody is an expert in doing that because health systems have just changed so much over the course of the last, call it 15 years, especially. But even more so over the course of the last 3 years. So we want to build really collaborative partnerships with some systems where we can almost like co-design what that entire process looks like, right? So there's some partners who are already kind of using Memora in a meaningful way, where as we think about taking that to the next level inside of those systems, and we think about building something that is truly enterprise scale, that is able to not just save money in a small pocket where it's saving 5 or 6 figures a month, but is actually saving 7+ figures every single month across the system, or generating new revenue in the 7 figures every single month. We want to have partners where we can do that really, really collaboratively and almost design the best possible processes, and as a result, not just set us up for success, but also make sure that they get the absolute most out of what Memora has built and designed so far.
All right, so let's talk about this fundraise then. So 30 million, that General Catalyst led with, a couple of these hospital systems. And this is like been described as like a strategic round, which, okay. So, tell me a little bit about this, because my understanding is that while you've been working, and you are partnered up with health systems, part of the strategy for taking this raise was to get into some new markets, specifically heading out into health plans and heading out into other digital health companies and, improving your tech and things like that. So tell me a little bit about, the strategy behind the fund, taking on this funding. This brings your total up to about 80 million now. So, I mean, tell me why take it?
Yeah, 100%. So Memora wasn't kind of proactively in the market and thinking about raising money. The reason that this financing came together is we had a couple of health system partners and health plan partners who we've been spending a lot of time with, and who we've had a chance to kind of commercially partner with, who actually reached out and expressed interest in potentially investing, partially based off value that they've seen in their system, and partially just based off of them making it very clear that this is a core technology and competency that they want to implement, and is going to be critical as they go through their digital transformation over the next couple of years, right? And we were thinking a little bit about the best way to structure that, and said, look, the reason that we want to pull this together is, one, because it's a group of highly strategic investors that have a lot of insight in the healthcare industry in particular, right? That includes groups like General Catalyst and Northwell and North Shore, Edward Elmhurst, and several others. And then the second reason was the capital was kind of coming at an inflection point where we feel like we have all the necessary kind of underlying data and have the underlying implementation muscle built out to start scaling a lot more rapidly, right? And not just in the health system segment where we are building out much more of these larger enterprise partnerships, but also in other segments where they can use our core care programs. So in the health plan segment, primarily around care management use cases, where they can use something that Memora has already designed around managing a complex patient and is validated in a provider setting, right? With digital health companies who are looking to stand up care management infrastructure, especially, tech-enabled services businesses who may be looking for better tools and insight on what is the best way for me to, one, actually manage all this clinical content that this patient needs. Second, engage these patients a lot more effectively. And then third is make it so I can do this scalably, so I don't just have to hire a ton of people to
build it.
and call patients the way that a large healthcare organization may do, right? And as a result, now that we've started to really build out and validate these programs, it makes sense to find all these other markets where the core competency of what Memora does is still the exact same in those segments.
All right, Manav, here's the big question. You guys are a conversational chat business. So does Chat GPT put you out of business one day here soon, or what? I feel like we've been hearing so much about this. Everybody's going under as a result of this tech. What about Memora?
Yeah. I'm sure, depending on externally who you ask, ChatGPT will put everybody out of business and nobody out of business, depending on who the person is. But our kind of perspective is that the technology is really, really interesting, and there's tons of meaningful applications in healthcare, but it's still probably a ways away, specifically from core clinical applications. So specifically for a business like ours, where there's a significant value and importance of having guardrails and what message gets sent at what point in time, because being able to guide a patient and engage them in their care plan is extremely challenging and extremely personalized, or obviously it would have been figured out by now, right? Plus, where every single workflow may be a little different, and you have to be very specific with what clinical protocol you're following step by step, right? We think of something like ChatGPT is really helpful around almost search applications, right? Or being able to aggregate all sorts of new medical information that gets put out into the ether, so that we can inform what our clinical team is doing in writing, managing, and updating our clinical programs. But it's not a technology that we're going to put directly in front of our customers anytime soon, right? Obviously, we're internally experimenting with it and trying to figure out what additional applications there may be. But it's still very much the early innings.
All right, yeah, I know. I have to ask though. Everybody's talking about it.
Yeah.
Have to give you an opportunity to respond since we're here. All right. Well, thank you so much for dropping by and for talking to us so extensively about what you guys are doing and what you are building using ChatGPT over there at Memora Health. Congratulations again on the fundraise. I mean, this sounds like it's, it will be a very useful injection of capital for you guys to continue to grow and build out and scale what you already have had such great success doing in the health systems, especially that you've been working with. So thank you so much for stopping by and talking with me.
Yeah, absolutely. Thanks so much, Jess.
All right, Manav. Well, to catch more interviews with the who's who of health tech as they are changing the way that we do healthcare, head on over to my YouTube channel. It is youtube.com/WTF Health. We'll talk to you guys real soon. Thank you again. Talk to you later. Bye.